Hello, everybody. Thanks so much for joining us today for this first Common Futures Conversations webinar from Chatham House. It's very exciting to see so many of you here and to be talking today about such an important topic. I hope the sound quality is okay. If you have any problems in that regard, just put something in the chat if I'm talking into my mic wrong or any other problem. I've just been texted by someone that my face is taking up too much of the screen. Apologies for that. My face is as big as my face is, and I can't go over there, but we'll crack on regardless. Turn me up if you need to. But I'm just going to get out of the way as much as I can today because we have an amazing expert here to talk about the ongoing COVID-19 pandemic. We're joined today by Dr. Ngozi Erondu, who is an associate fellow in the Global Health Programme at Chatham House. But who is also an associate professor at the London School of Hygiene and Tropical Medicine, and has worked extensively with the WHO and various other ministries of health and working on public health policy around the world and epidemiology. And she is here to answer your questions, which have been submitted through the Common Futures Conversations community. So thank you to everybody who submitted questions in advance. Ngozi, thank you so much for joining us today.
Thank you, Ben, and thanks to the Common Futures team who invited me. I'm really, really pleased to be here.
Thank you so much. And I just wondered if you could tell us a little bit about the situation where you are now, because you're in Dubai, that's right?
Yes, I'm in Dubai. So yeah, like we were just speaking a little bit before the session started, I'm sure everyone knows that Dubai is in the United Arab Emirates. And it's just very interesting how different governments and government structures can do different things. Because Dubai is basically like a monarchy, authoritarian regime, but much more relaxed than like North Korea. They can do very sweeping measures without kind of any type of democratic input. But I will say overall, it's been very gradual. Like we were on curfew, we were doing like a 6 p.m. to 8 a.m. curfew with kind of gentle reminders to stay inside as much as possible. And so I think everyone was really kind of, doing what England is doing right now, like having each person in the household could go out once and, run or something like that. But now we've gone to full lockdown. And so they're like actual police on the street. If you're like roaming around without, saying I'm going to the grocery store, you should have a receipt if you're returning. So they're being very strict now. But Dubai is also testing extensively. So I trust that their reaction or this measure is because they've seen an increase of local transmission or community transmission, but they're also not publishing numbers, but that's what I think. So right now we're on a 2-week lockdown.
Okay, yeah, thank you very much. Well, just before we get into the community's questions, I have to do a little bit of housekeeping. So everybody, just for your information, this event is on the record today, which means that we may publish the recording afterwards on social media or take some clips from it or something. So if you don't want to be identified, it's possible to submit questions using the Q&A function on Zoom. You can do that anonymously if you don't want your name to be read out, but otherwise assume that this is on the record. Okay, great. So first up, I just wondered if we could talk a little bit about different ways that governments around the world are attempting to combat the spread of COVID-19. And just really basically, I wondered if you could clear up something for us, which no one seems to be able to do, around masks. So we have a question from David in Belgium, and he said, should we or should we not be wearing masks when going outside if we don't have any symptoms? Because there is information all over the internet which seems completely contradictory in this regard. What's the policy on masks?
Right. So thank you, David, for asking that question. I can understand why it's very confusing. And I think to kind of explain, I want to start with, why it's confusing and why there's a debate. Part of it is because of human behavior and what we feel, we want to control something. We want to be able to have a way to protect ourselves during an outbreak, a pandemic, anything like that. But the other part of it is science versus sentiment. And when I think of sentiment, again, it goes back to like kind of human behavior, but it also has something to do with politics. So if we think about the science, we know that the respiratory droplets that carry COVID-2, the virus SARS-CoV-2, which is the virus that can infect you and give you COVID-19, those droplets can go through masks, especially masks that are just, regular surgical masks or cloth masks. They're small enough to go through those. So those masks maybe provide, it depends on the estimates. There haven't been that great mask studies. They might provide, up to 15% of protection as far as a barrier. But if people are wearing those thinking that they're going to be protected and they're, not practicing social distancing, not practicing washing their hands for 20 seconds or more, then it's a false sense of protection. If you add on top of that, there's been a global shortage of masks, so medical masks specifically, because people also have heard a lot about N95. So N95s are not masks per se, they're respirators. And that's because N95s are used, they're like a specific mask that's used in the hospital or healthcare setting that can actually be fit to your face. And so nurses, surgeons, doctors, they actually get fit tests to wear their N95s, and that can keep out up to 95% of these small particles. So those are much more effective if you're wearing them correctly. So we're at a shortage of N95s, a shortage of surgical masks, and that's why the guidance has mostly been only wear masks if you're sick. And so why should we wear them if we're sick? It's because, again, we know the transmission mode is droplets. And so if you sneeze or if you cough or if you talk and you kind of spit when you talk, then we know that these droplets can be propelled up to 1 meter, sometimes even further than that. So if you have to go out, like if you're not practicing, self-isolation or self-quarantine, but you feel sick, no matter if you have a confirmed case of COVID-19 or not, then the public health general advice has been, then you can wear a mask. So then recently, I'm sure everybody saw that the US changed their recommendation from, people to not wear masks to, okay, if you're going to wear a mask, actually, I think they said you should wear a mask if you go out, and it should be a non-medical cloth mask. Now, again, there are no really great studies that would do anything beyond be a barrier. So if you're sick, you won't get other people sick. And so the idea and the thought is that because there are some levels of asymptomatic transmission, meaning that you could have COVID-19 and not be showing any symptoms, also you can have COVID-19 and for a period of time. So within that incubation period, you could be, it's called shedding virus, but you can be infectious basically, and get other people sick before you start showing symptoms. So because we have those dynamics happening, it's just better, is what the US is saying, to wear masks all the time. And so I think for me, I used to not wear a mask at all, unless I was traveling or afterwards when I was traveling, because I was high risk when I travel, because I'm coming into contact with people from all around the world. But WHO just met again, and yesterday they came out again and said that, wearing masks outside isn't necessary. I think that, you take the information and you do what you need to do. There are some countries like the UAE, for example, where now we actually can't leave the house without wearing masks and gloves. So you have to also kind of follow the policies of your country, but at least kind of what the debate is, what the information is, and you can use that to do what you need to do.
Thanks very much. Just to so early on abuse my position as chair, but I just wondered if you could tell us a little bit about testing. So obviously the director of the WHO has been saying the answer to this is to test. And there's been a big debate in the UK about whether we were too slow to begin testing at a mass scale and why we're not able to deliver the amount of testing that, say, Germany has. I just wondered if you could explain the significance of doing that and whether it makes sense to be testing huge numbers of people who haven't contracted the virus and what benefit that gives us. And yeah, tell us why we should be testing.
Yeah, sure. Okay, so what we're seeing right now, these kind of wide sweeping measures, such as like entire countries that are locked down, this is quite unprecedented in like the modern era, right? Why is that? I had the privilege of responding to the Ebola outbreak, and I was in Guinea, and there was never a time where the entire country was shut down. It was much more targeted, and someone could say, well, Ebola doesn't spread by droplets. It's not as transmissible as COVID-19. And that's true. But another reason why it was much more targeted is because we use data to inform the strategy. So right now, in some ways, a lot of countries are kind of going out blindly. They're saying like, everybody stay at home. That way you reduce your exposure to other people. We know that for every one person that gets infected with COVID-19, they can infect up to 2.5 people. And so that's why we see this like exponential growth, because then those people, each one of those individuals can infect 2.5 people, and so on and so on. And so that's why we're all sitting in our houses or sitting in our flats, because the idea is that since we don't know who's sick and we don't have enough tests, everybody just stop. But the truth is that's not sustainable. Everybody's not going to be compliant. One, it's not sustainable for our economy, and it's not necessary really if you are testing enough. Meaning, if we test, like even random community testing, then we're able to kind of extrapolate and understand like what percentage of the population actually is getting sick or actually has the virus and could be a carrier. It also informs public health interventions such as isolating sick people or people who will become sick and looking for their close contacts. And that's really how you stop transmission of infectious diseases. You do this thing called contact tracing. Like when I was in Guinea, so you do it during the incubation period. So I think most people know that the range for the incubation period for COVID-19 is about 2 days to 14 days. So that's when you would get sick, or you would start having, that's before you would get sick. That's how long you can have the virus. And then you would start showing symptoms. And so the idea is that for everybody who has been infected, you find their contacts and you monitor them during that incubation period. You see if they're going to get sick. If they do get sick, you isolate them. If they don't get sick, you just wait it out, and then you say, okay, you can go now. And if you have serology tests, rapid tests, which we don't have right now, but if you have them, you can actually give them tests and see, like, you can actually confirm that the virus or the infection is gone, basically. So that's why testing is really important. So it can inform your strategies, inform your intervention. Also, so for example, in the UK, the entire UK is on lockdown. I have friends that are in the Lake District, they're in other places in the UK, and they might not necessarily have the same risk as London has. So if we have testing again to inform us, maybe we do something where we stop travel between different regions of the country. We prepare we use healthcare workers from other parts of the country to help us with the actual areas that are going to be overwhelmed. So that's what they're doing in Germany. Germany tests about 350,000 people a week, compared to the UK that tests about 10,000 a week. In Germany has a case fatality rate, or what people are calling like the death rate. So the percent of people who actually die from COVID-19 out of all the people who are cases or who have confirmed cases of COVID-19, their mortality rate is about 1.6%, whereas Italy, it's about 12%, and in Spain it's 10%, and that's a huge difference. One reason why they have such a low mortality rate is because they're testing more, so the denominator is higher. But another reason is because they're able to find everybody, or as many people as possible, that are carrying the virus, and they're able to stop them and stop their contacts from infecting other people. So testing is really important, and I think the UK government knows that. Yesterday on the daily briefing, Professor Chris Whitty, the CMO, he actually said, we can have a lot that we can learn from Germany. But another caveat is Germany has a lot of money as well. It has like 3 or 4 pharmaceutical companies that are based in Germany. And so I think they already had an advantage when it came to testing. And I really hope that the UK, the US, and I had a lot of questions from African countries and low income countries. That's a whole nother level when it comes to it. But yeah, I hope everyone can kind of increase their testing soon.
Mm-hmm. Yeah, thank you very much. Okay, so we have another question which actually relates to what you were just saying there, from Max in the UK, and he would like to know about the possible scenarios that are out there for dealing with this sort of thing from the point of view of lockdowns. Like, obviously we've seen increasingly countries, just as you say, just blanket locking down everything. You can't go outside except for certain particular things. Mm-hmm. Is that something that you think we should expect to continue on a kind of on and off basis? Like they might let us out for another month and then close it down again later in the autumn? Or do you think increasingly as testing improves, countries will be moving more to that kind of halfway stage of social isolation, but not complete lockdown?
It's a really good question. Yes, I do think that, so we all have to kind of keep in our minds that the end game is a vaccine. Like without a vaccine, we are going to be limited to these like physical distance strategies, basically. I think, yes, with more testing, we will be able to have much more targeted response. So, I mean, I think people might have heard just a few days ago, or was it yesterday, that Japan called a state of emergency, but they haven't shut down the entire Japan. There are hotspots, basically, that they are restricting movement. And I think that, you know, other countries will follow suit. Even in Nigeria, they've done the same. So they're using, you know, their knowledge of the imported cases, and they have put Lagos, Abuja, and Ogun State on a lockdown of sorts. And so I think that will change. And also, you know, just like what happened in Dubai, where, you know, we had freedom of movement and then something changed, maybe more community transmission. Then, so I do think that we'll have some, you know, remnant of normalcy, you know, in the coming months. But I also think, again, since the vaccine is the end game, and maybe we're just changing, maybe the society, there'll be like a pre-COVID-19 society and a post-COVID-19 society. People are realizing that a lot of those meetings that we were going to, we can just do them over Zoom, right? And so I think social distancing has to be woven into our culture now, right? Like I don't know if everyone needs to get on the tube every day and go to work. Maybe we can do, you know, working from home half the week and then going in, you know, in really important meetings. You know, maybe there'll be more telemedicine and, you know, school online and things like that. So those are some of the policy changes that I'm trying to work through with some countries, because I think that we do need to kind of just change our way of being in the midst of this. Yeah.
Yeah, absolutely. And we've got a whole range of questions on what the future world is going to look like if we get out of this. But I just wanted to crack on with some more of the kind of specifics of limiting the spread. And I have a question here from Mwape, who is in Zambia. And he wanted to talk about protection of medical personnel. Because obviously we're seeing a lot of medical personnel on the front line who are contracting the coronavirus due to inadequate protective equipment and supplies, and that's also been a major debate in the UK as well. And I just wondered, how best do you think this challenge can be addressed?
Okay, thanks, Mwape. So I actually really thought about that question, and I think that the good news is that there's been a lot of innovation in this area, even in, you know, poor countries or resource-constrained countries. There's been innovation, but there hasn't been enough to really fill this gap. But I'll give some examples anyway. So in Zimbabwe, the president called on local universities of engineering and technology to make hand sanitizer, masks, and gloves. Across China, India, Bangladesh, local manufacturers have increased production. So that's about, like, you know, getting more of the commodity, the product out. But then there's also been some, again, cultural changes that have been suggested in order to conserve or to kind of stretch PPE. So for example, and PPE is personal protective equipment. So health systems have been like readjusting their schedules. They've canceled elective procedures so that they can conserve their workforce, conserve their energy, and conserve their equipment, and really focus on COVID-19 patients. And so this doesn't mean like emergency surgeries or emergency operations are, like, you know, stopped. These are elective surgeries, which could be serious. Some of them are quite serious, but as far as when you triage patients, they wouldn't be the highest risk or the highest priority. So that's one way that we can conserve PPE. Another thing is that different communities have called on different professionals in different sectors to reclaim PPE. So if you just think about where masks are used, it's not just used in hospitals, right? Dentists use masks, farmers use masks and gloves, hairdressers use gloves and masks, manufacturers of different items use this. So there's really been a call, and I think a collective response for, you know, these different sectors to donate the PPE back to hospitals and clinics who really need it the most. And then there's been some suggestions that, you know, a lot of healthcare workers have gotten sick, and a lot of them have recovered. And so one idea is to use these immune healthcare workers to be on the front lines. But the caveat with that is that we are not sure how long immunity lasts. I suspect that we can be sure that we'll have at least a couple of months of immunity. But again, without like the proper test, it's a bit dangerous. But these are some of the kind of innovative ideas and suggestions that have gone forward. Yeah.
Awesome. Thank you so much. I wanted to continue this idea of what we can be doing about this on a kind of local level, but thinking particularly about sub-Saharan Africa now. So we have a question from Mirabel, who's in Nigeria. And she basically would like to know what best practices sub-Saharan African countries can take to curb the spread of the virus, particularly from the point of view of the sort of economic and social effects that things like total lockdowns can have. So she says, instead of total lockdowns, curfews, restriction of movement, which all leave a lot of vulnerable masses with little sustenance, do you think that governments could provide alternatives to this? What other ways are there to limit the spread? Or are people going to have to accept that lockdowns are the reality?
Yeah, that's a really good question. And this is something that I've been thinking a lot about recently, because I don't know if you all have followed the news about what happened in India, where President Modi at 8 p.m. told the entire 1.3 billion people in India that at midnight that they were going to lock down. And that is highly, highly irresponsible. That's what I think. And it's very dangerous. First of all, even though India has made huge progress when it comes to their economic development, they still, I mean, they 1.3 billion people, and there are millions and millions and millions of impoverished, poor people living in highly dense, packed slums. And so without proper thought, just copy and pasting measures from the West is really, really irresponsible. And it can lead to more death than you would have seen from COVID-19 anyway. And so what happened in India is that there was like a mass exodus of migrant workers. So people who, live in a village, but they work in the cities as like house help and other, other roles, because they had nowhere to go. So they started trekking back to their villages. Some of them dying on the way of exhaustion. Some of them dying from, from hunger. And yeah, so not having thought out in context specific public health measures can be very detrimental. Again, I think that the science should drive the public health measures as well as the context. We do have a few best practices. This is Dr. John Kinkasong. He's the director of Africa CDC, and he always talks about the COVID-19 outbreak as like a day, in the US and the UK are in the afternoon of it, and Africa's still in the morning. And so the examples I'm going to give are very early responses. But so South Africa, for example, while they have done a 3-week total lockdown, I think that they're much more thoughtful than, first of all, they have a lot more money than other African countries. They have the biggest economy in Africa. But they also know that they have, I think more than 50% of the population live at least near the poverty line, and they also have high rates of unemployment, especially amongst youth. So what they have done was they've opened kind of food halls in a way that they can make sure people can come in and eat every day, still doing their social distancing. One thing that's also very prominent in different countries throughout sub-Saharan Africa, as well as countries Southeast Asia and Latin America, is, we tell people to wash your hands for 20 seconds, and so many people don't have running water, right? And so South Africa has brought, these huge water tanks to different townships to ensure that people have water, not just to wash their hands, but also just to drink. Rwanda is also a good example. Again, Rwanda is a small country. They have done a total lockdown, but they have a program in place for households that make under a certain threshold where they every day are brought food. And that's the same thing that happened in China. Like they made sure that they provided the things and the items that people need so that people can comply with these measures anyway. Nigeria, I think, is a good example of doing like a targeted lockdown. Lagos State has been pretty exemplary in making sure that they provide, again, they're doing something similar to South Africa and having kind of like these food halls for impoverished populations. And then in Northern Africa, there's also some good examples. So Tunisia, Egypt, they're providing direct cash payments to all households. In Tunisia, if you have like a disabled child or if you have an elderly parent, you get more money. And so this is a way to mitigate the, economic effects of, a total lockdown or a partial lockdown even. There are a lot more bad examples, to be honest. I think a lot of countries are not thinking about their poor, even in the West, there's huge homelessness in the US. What are those people supposed to do? And the whole fragmentation of the state-by-state approach without data to inform it is also really worrying in the US. But in the global South, as we call it, there are a few good examples, but I hope that countries will be more like, so Benin, the president of Benin was just like, no, we're not doing a lockdown because people are going to die because we don't have any money. And I'm not saying that's the best way to do it because, he should be thinking, okay, what can we do? But I think that honesty is what people need to hear because it just won't work, in every country. I wanted to add something else. What countries can do that have large poor populations is really send these messages about social distancing to the lowest level possible. So I know it's easy to think, okay, like, if you live in like a refugee camp or if you live in like an informal settlement, how are you going to do social distancing? And I think that's a good point, but there are some things that we can do. So social distancing doesn't have to be at the individual level. It can be like in the area level. So like if you, like in Nigeria, we have local government areas. If there's a way to, say, stay in your LGA for 14 days, stay there for 3 weeks. Like you can go within this because if it's circulating there and we have more tests and we're able to really quarantine this area, that happened a lot with Ebola, then people are still able to make kind of their day-to-day like livelihoods, but they're not spreading it around the country, which is much more difficult to contain, or to really manage. So that's one thing we can do. Also, when you go to the market, you can put like chalk X marks on the ground to show people what social distancing is. There can be more regulation with buses. If you're from Nigeria, I'm sure you know that, we just stuff as many people as possible in buses, or you don't even want to think about like I think there are matatus in Kenya, there's different things that we can do to make sure that we increase distancing. Because if the COVID-19 outbreak or epidemic hits African countries, especially the poorer ones, the way it has done in the West, it will be very difficult to recover from it because we don't have critical care units the same way they do in richer countries. So right now, really containment and prevention is really what we need to like focus on. Yeah.
Mm-hmm. Maybe slightly related to that is the idea of international aid as well in this time. So we've got a question from Samantha in Germany who is asking about basically the support that developed countries have in the past offered to developing countries in times of epidemics such as Ebola. She's wondering whether the financial packages that these countries like the UK and the US, these huge stimulus packages that they're having to implement domestically, are going to limit their ability to help countries further afield. She would like to know basically, what do you think the impact of these national support packages are going to have in terms of their ability to support developing countries on COVID-19?
Yeah, I think Samantha's right that, there will be an impact. It will be a reduced, countries are very inward looking at the moment. But in some ways, we've been going more nationalistic, more inward looking for the past 4 years, really, so we're already in kind of a different era than we saw with Ebola and some other previous outbreaks. So we've been on that trajectory for a while. So definitely they'll have less monetary support, and even more so. So like, I'm Nigerian American, but I flew into Guinea basically to offer my expertise to help with the Ebola outbreak, right? And we've been parachuting experts into poor countries for decades, and that is unsustainable. And now we see why it's unsustainable. It's always been unsustainable, but now when you have an actual global pandemic, when people need their own experts, then these poor countries are kind of left to fend for themselves. Well, I will say that after Ebola, we did see an increase in national and regional institutions to provide that expertise, to provide that coordination. So for example, Africa CDC, the Africa Centers for Disease Control, that was established in 2017. And we can see right now that they've had a really important role in equipping laboratories, making sure that they're able to, that they have the training on the proper machines to confirm COVID-19, but that they also have the reagents and they have like the test kits. So they've been really essential there. They're also been very good at, developing guidance for African countries. Same, Nigeria CDC, it's a National Public Health Institute. We've seen more National Public Health Institutes come up all throughout Africa, and a few in Asia. But Asia does have their own kind of post-SARS institutions that has been really helpful as well, as far as helping them with this outbreak. So, but still, it's not enough. It's the thing is, I really try to bring out the things that we should have hope about. But the truth is, you can't resurrect in some way. I wouldn't even call it failing health systems. And like in sub-Saharan Africa, they have just been very weak and very insufficient for a very long time. And it takes more than just, kind of reactive spending 3 years after an outbreak to have the capacity that we need to actually deal with something like that. So it will be very scary if there's not enough resources, and it looks like at the moment that there's not, for African countries to, kind of build up some type of mechanism. I mean, the great thing is that, philanthropists and billionaires like Jack Ma and Bill Gates, they have been giving quite a bit of money to African countries, but yeah, who knows how far that will go, but it's still good. I think it's good.
Mm-hmm. Absolutely. Just on that institutional question, we have a topic that was raised by Mateusz in Poland, who wanted to know what your take on the response of the European Union and the African Union has been to the crisis so far. He says there's a growing number of voices suggesting that the EU is not supporting its member states to the extent that it should. Do you agree with that? But then also, are the same voices being heard on the African continent? What's been the response of the African Union, and what have people been saying about it? Okay.
Thanks, Mateusz. So I actually haven't heard that many voices regarding the EU, and it's probably because I've been very Africa-centric the past couple of weeks. But I will say that the African Union operates quite differently than the EU. I mean, Mateusz knows that the EU is economically, dependent on each other. There's lack of borders, it's a very different entity, whereas the AU is more politically connected and, advisory, and it's just not the same setup really. But the Africa Centers for Disease Control is an organ of the AU. And I kind of explained what their essential role has been during this outbreak. I think from the professional community, they have been lauded for their work, but they're also a very new institution. So there's actually just so much that they can do. I've actually had to proactively reach out to them and say, oh, do you need help with, developing this guidance or this policy? Because, just because of bureaucracy, really, even hiring people, it takes a long time. So that I don't think the AU is at it's not at its capacity as far as, just with staff and experts. And so I think there's a difference there. But I did want to, kind of highlight other institutions. It doesn't have to be such a large region. There are also kind of sub-regions that have kind of economic regions, like in Africa or in West Africa, there's the ECOWAS. Economic Community, actually I forgot what ECOWAS stands for, but it's West Africa, and it's not exactly like the EU, but they are much more connected economically, especially the French-speaking countries. And then in Southern Africa, it's SADC, and I know that they have put out recently some regional coordination of movement across borders, and so these sub-regional entities can also be really helpful as far as their response to the outbreak.
Thank you very much. We've had a couple of questions about the idea of immunity and herd immunity. I've got one in the chat box right now, actually, from Nino down there as well. I was just wondering whether you could explain the concept? Because I have to say, it's something that's being thrown around in the media a lot, and I don't have a really good understanding of the science behind herd immunity. But is that a goal? Is that a way to deal with this crisis? Or are the implications of aiming for herd immunity too kind of catastrophic? Would it lead to too many deaths?
I think it would be catastrophic and lead to too many deaths. And so if you think of herd immunity, it's the proportion of population that need to have some immunity either by a vaccine or through natural immunity to prevent the rest of the population from getting sick. And so what it really means is that the virus thrives on susceptible populations, right? So like if we were all sick, nobody would be able to get the virus. So that's one way to kind of kill out a virus. It's just everybody gets sick. But there are some people that if they get sick, they will die. And that's what we're seeing, right? We're seeing that the vulnerable populations, such as people with underlying health conditions, elderly, that a lot of them have weaker immunity, but it's not strictly them, but it is mostly them. I think that's also getting kind of skewed in the media as well. And it's not because, I think the reason why it's being skewed in the media is because young people are not taking it seriously. And so the media is really trying to highlight, when like a young 30-year-old passes away or something like that. But if you look at the case fatality rates by age, I mean, it's like 0.2% of people, in their 20s are actually dying, 0.3 or 4% of people under 40. And then when you go to, 60 to 70, it goes up to like 6%. Then you go to like 70 to 80, it goes up to like 12 or 13%. You go over 80, then it goes up to, it goes beyond 15%. And in some countries, those numbers are even larger. I was just looking at, what country was that? It might have been Italy, where it was like 27 or 30% of people over 65 were dying. Don't quote me on those numbers, but it was very, very high. And so if you think about that surge of critical care for that population, one, it will obliterate the health system. Two, it puts healthcare workers in more danger, right? Because there's this whole concept of viral load. So they're seeing more people that are more sick. And so we're losing doctors and nurses that we need for everything else, really, And then if you think about herd immunity and you put it in countries that are like maybe, Botswana or South Africa, where, in South Africa, 7 million people live with HIV. In Botswana, about 20% of their population are HIV infected. Or you think about, DRC or Nigeria, where they have like 40% of people are mostly children who have malaria, then it's even more catastrophic, right? Like, even though we know that, Africa has a very young population, that only about 7% of the entire continent is over the age of 65. We have not seen COVID-19 in a population that has so many other issues, like, other infections, other diseases, malnutrition, tuberculosis, everything. And so if we know that your immune system, well, like every disease, but your immune system is really your barrier. It's your like last line of defense. What is it going to look like if we just let it go crazy in, poor countries? So I think herd immunity is a very dangerous concept. The only way we can get herd immunity through COVID-19 is through a vaccine. And that's the end game. And that'll be at least a year to 18 months away. So.
Yeah, we had a question on vaccines from David again in Belgium. And what is it about the vaccine process, the development process that takes the time? Could you talk us through like the process of developing a vaccine? What is going to make it last for 18 months, 2 years?
Yeah, sure. So I'll first say that most of the time, it takes like almost 10 years to make a vaccine. That's conservative. Like usually it takes much longer. So 12 to 18 months is another level of, expedition. It's very quick. And why can that? Because I might answer this question along with Mwape's question, who asked about like safety, right?
Mm-hmm. Yeah.
Yeah, I can answer those two together then, basically. So there are different phases of vaccine development. So before you even get into like the clinical trials that we all kind of have heard about, there are kind of pre-development vaccine, like a lot happens like in labs, then there's like testing on animals, they call them like animal models. And that takes a lot of time. And then just to see like if there's like any side effects or if it's actually effective against the pathogen that it's supposed to protect from. So a lot kind of goes on just in the early years of vaccine development before you even get to human beings, because obviously you don't want to kill human beings with something that's supposed to protect them. So why are we at the point where we can have a vaccine in 18 months or less? It's because of technology, really. So like vaccine development before used to be, I think it's important for me to kind of read this to you because it's really interesting, but I think people need to, because there's so many like fake news and dangerous things going around about the potential vaccine for COVID-19 that it's important for me to just kind of explain this. Okay, so, all right, so yeah, so before, the way we made vaccines is that we, sorry, I'm not seeing what I want to do. Could you give me 1 second?
Yeah, of course. By the way, attendees, if you have other questions, keep them coming in the Q&A box. We've already had one in. I'll definitely ask that one. But if there are others, then yeah, don't wait until the end. Just keep them coming so that we can queue them up and feed them into the conversation.
Okay, so 10th of January, the Chinese scientists, they made the full genetic sequence of SARS-CoV-2, so this virus that causes COVID-19. They made that public, and because they made that public, we were able to get a pretty quick test, it's called a PCR test that helps us to understand if the virus is in you. It's again around genomics, but using like a new vaccine development that only uses genetic material, that also helps us to expedite vaccine development. Before, it was mostly like cell culturing, just kind of, if you imagine someone in a lab over a petri dish, that's how we developed vaccines, which takes much longer. So DNA or RNA-based vaccines, they are not made with weakened or deactivated virus, which is what most of our vaccines are made out of. And so they can be produced, like the entire vaccine can be produced in the lab, and it's much faster and more reliable than traditional vaccine processing. So you're not growing eggs, basically. And one really interesting thing that I've seen recently, I don't know if this is good or bad, because this kind of goes into what Mope's concern about how fast we're making vaccine, is there's this country in the US called Moderna, and they have developed the first COVID-19 vaccine, and they use this genetic platform called messenger RNA or mRNA, and it only took 42 days to move from vaccine design to human testing. 42 days. Like before, it took years to move to that level. So that's one reason why we're seeing see it so expedited. But the concern is that while these genetic platforms are promising and they're really, really fast, we've never had a vaccine that's been made out of RNA before. And so there's no vaccine currently that's been made this way that's approved for human use. But the idea is, because this is a pandemic, we can move through human trials quickly. So, and we can do it in a way that's still safe and still efficacious if we intersperse human trials with animal trials. So usually you finish all the animal model and then you move on to like phase 1, phase 2, phase 3 of human trials. And phase 1 is like a very small number of human beings. And then phase 2 is much larger. It'd be more like a randomized control trial or control test. And then phase 3 is actually like field testing in a real life situation, like, all of our countries that are in the middle of this pandemic. And so the idea is that these clinical trials can be sped up if, one, they're highly monitored, and two, you kind of integrate the animal and human testing, if that makes sense. So I hope that, our governments will still stay on top of all of these pharmaceutical companies to make sure that, and I believe that they will, most governments, and to make sure that, the new vaccines are safe and effective before making them available to the public. but yeah, because of the unprecedented nature of COVID-19, governments and industry are really working together to expedite the process. So that's why. Does that make sense? Did I explain that clear?
It felt clear to me. I hope so. Let's say yes.
Okay.
So thank you very much. I just wanted to feed in a question that we've had on the Q&A from Olfa, who's in Tunisia. And she would like to know, basically, is there any information that we have at the moment about whether the virus is mutating? And is that a serious concern? And how would that affect the search for a vaccine?
So I have to say that I'm not a virologist. So I do read what you guys read about mutations, and I've recently heard that it's not much of a concern, that it seems like, it seems like the parts of the virus that we need to be stable in order to have a vaccine are not mutating, even if other parts are. And so that's not an issue. I think it has something to do with spike proteins, but, maybe you should Google spike protein and Google vaccine and learn more about that. But I don't feel that qualified to speak about it.
Cool. Yeah. Okay. So we have a question here from Tobias, who I believe is in Italy. And he says, thank you very much for a fascinating talk. He'd love to ask, how is the science communication in African countries around this topic? We've seen a lot of misinformation in Western countries, as well as a lot of scientists on social media trying to debunk those claims almost live as they're coming out. But is the situation similar in African countries as well?
Yeah, I mean, this, everyone's talking about this infodemic that we're having right now. And I do think that is as dangerous as the pandemic. And I'm not saying that lightly. I was just maybe 2 hours ago on another webinar and we got hacked. And there are some people who really feel that that all of COVID-19 is a conspiracy, that it's not true. It's very scary. In Africa, there were different, so it's really, again, important to understand culture and context, right? There was a really interesting map that came out that showed the percentage of people who go to some type of religious institution once a week. And in Africa, in some countries like Uganda, it was over 90, whereas in China, it's 1% or less. In the US, it's about 36%. And so it's very important that, religious leaders in Africa are the ones that are the champions, are the ones that are telling the truth. And that is not the case in a lot of places. There's been very influential leaders throughout, different countries that are saying that, this is not true. And when the vaccine comes, don't take it because that's just, instrument of poison. And so that's really scary. So when we actually get a vaccine, that'll be really scary. I also read, there was a recent poll in Nigeria that showed that I think it was a quarter of the population said that they couldn't get COVID-19 because they're a child of God. And so again, this misinformation is really scary. It's people are going to not take, public health measures and instructions such as social distancing very seriously because of this type of misinformation. I think also that governments around the world, but especially in sub-Saharan Africa, our people are very skeptical of their governments. There's so much corruption in a lot of countries, and not just in Africa, everywhere, but I'm just saying it's a bit more concentrated when 50% of your population is impoverished. And so when government officials are saying this is happening, blah, 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 in Nigeria, a lot of people think that, this is just a way for the government to get more money. And, and so again, it can have detrimental effects to the response. I think that there are some innovative things to do. I know that in South Africa, South Africa has a wonderful, just kind of, media platform, not media, what's the word? They have a lot of Hollywood-esque, influencers, I guess that's what I would say. And so a lot of their celebrities are being involved with the communication strategies, because sometimes I do think government just needs to get out of the way. Some people weren't sympathetic in the US about COVID-19 until Tom Hanks got sick. And so, using these champions, using these kind of darlings of the media, that's one way to get in front of this infodemic and fake news. But also we need good leadership. I think that's really kind of my takeaway. Sometimes when you're behind a book and you're I'm studying epi curves and things like that, you think that, okay, I'm just going to say something because I have the science to back it up, and then people are going to do it. And that's not what happened, right? Leadership is so important. When you give people mixed messages, like, Donald Trump said that, we have a recommendation for everyone to wear a mask, but I'm not going to do it. What are people supposed to do with that? What are people supposed to do? So that's really, that's really important and effective. Like in the UK, for example, I think that I really value Professor Chris Whitty, who's the CMO, and it seems like, he really tries to present the science, but also present the truth, like present the shortcomings of the government. Maybe because CMO is less political than like prime minister or whatever. So he's able to be a little bit more honest than some other people. So leadership is really important in communicating these messages also. But I will just say one more thing. I was in Singapore about a month ago, and I was really impressed with how they combat fake news. So they have this government website that basically finds everything in the media that's fake news, and they just debunk it. So you can really just go there, and they really get ahead of the issue. And Vietnam does that as well. So I think there are a lot of things that our governments can do to get ahead of the issue immediately, because if you let things linger, they start to really kind of marinate into people's beliefs, and then it'll be really hard to kind of pull it out later. So.
Absolutely. I'm conscious of time, but I just wondered if we could get in two more questions.
Okay.
So one is from Emma in France, who would like to talk about the kind of knock-on effects of the pandemic from the point of view of the environment. So she says there's been a lot of discussion about the wildlife trade, destruction of habitats, and biodiversity loss contributing in some way to coronavirus emerging, but also other pandemics in the past. And basically, she's wondering about the relationship between pandemics and climate change and habitat loss. And she just wondered if you had any thoughts on the relationship between environmental conservation and pandemics.
Yeah, thanks, Emma. I think it's a really good question. I was thinking about it. I don't know much about climate change, but just from my experience in kind of rural communities, what you see is that as we develop, we are pushing the living area of the animals further and further back. But obviously they're just not going to disappear. Even though we are wiping out a lot of animal populations, they're also living with us more. And so in West Africa, we have something called bushmeat, which people eat anyway, but you see much, much more consumption of bushmeat when you have more development or you have more destruction of the environment, because those animals are closer to us, right? And there are theories that part of that some bushmeat were hosts as far as carriers basically of the Ebola virus during for the West African outbreak. And then we know that also 80% of emerging viruses, are zoonotic disease, full stop. 80% of emerging infections, they come from zoonotic diseases, meaning they have an animal source. And so I do think that, we need to be more cognizant of the animal populations. And I see this, funny enough, I see this happening more organically in kind of, I don't want to say less developed places, but places that are more traditional. So I worked in Sudan before, and they just seem to have a really good, what we call One Health kind of dynamic going on. One Health is, this convergence of animal, human, and plant health or agriculture, in that you're surveying all the health effects and all of the kind of characteristics of animal and plant health alongside with human health, because we're all connected. And so I think that if we have more of that, more One Health programs, more appreciation of what we're doing to animals in their environment, which, is under climate change, I think that could really help us with protecting human health, really, to be honest. I think that if we go back to using more traditional measures or traditional methods in our agriculture and production, a lot has been done in northern Nigeria, with replacing these huge industrial machines for farming and things like that with more traditional methods. I don't know the name of it, but it's you take a stick and you put it really deep and then you seed that way. that really helps to conserve that area for future use as well. So I think that we need to definitely look at our effect on the environment. I would say as a human health epidemiologist, I would look at that because it protects human health. But yes, just for the fact that we need to be good stewards of the environment for the future. I think that definitely needs to come to the forefront more.
Mm-hmm. Absolutely. Thanks so much. Okay, so final question. Sorry, it's a bit of a massive one, but it's one that came through in several of the different comments that we had from our community. And basically, it's about thinking about the future. People are already kind of describing this pandemic as a kind of once in a lifetime, once in a century kind of event, comparing it to the Spanish flu 100 years ago and all of this stuff. But there's also this sense, I think, that we should be expecting to experience more of these events in coming years, particularly now that we're living in such a globalized world and the spread of disease can be so easy. So I suppose with that in mind, what measures do you think people should be putting in place as governments, but also businesses or international organizations, in order to kind of prevent this sort of thing, or to be better prepared at least when the next pandemic comes?
Yeah, very good question. I think governments have to stop looking at health as a commodity, right? Like, I truly believe that health is a human right and that there should be universal health coverage in every single country. And that has been something, I mean, you all probably know the director of the Global Health Program, Rob Yates, of the Universal Health Center at Chatham House. It's something that, people like Rob Yates, people like WHO, entities like WHO have been pushing for decades. And yet, so many countries continue to follow models such that are broken, that are expensive, that don't work, such as the model of the USA, where, when health becomes a commodity, then you do everything to cut costs and increase profits, which is what we're seeing. The lack of hospital beds, the lack of ventilators, that all has to do with, how can we make sure that that we're reaching our kind of profit margins instead of helping the health of our people. So I think universal health coverage is a must, and it has to be at the forefront in every country, but especially in poor countries. I mean, for some reason, there are so few countries in kind of the global south that have universal health coverage. Thailand is a great example of a country that even when, they were kind of at the lowest part of their economic development, they still put in UHC, and they've been seeing so much positive returns from that. And also, even though I've had this kind of debate with a few health economists that a healthy society is not actually correlated with a healthy economy, but I can't see how that's true. It has, I don't really care about the studies because I don't think that we have enough studies that actually look longitudinally. Like, doing a snapshot of something is not the same as actually looking at the NHS from beginning to now and what it would have been or what it was before. Anybody who knows much about history, and I do care about studies, let me go back, I care about science, but I'm just saying that, I think a lot of the studies on this specific particular component about health and wealth not being correlated, I don't think that they're done correctly, or that they're comprehensive enough to really capture kind of the intangible effects of a healthy society, or a society that has equitable access to healthcare. It might be really challenging to actually find a direct link, but I know, as being a resident of the UK, that there is nothing like knowing that if you break a leg, that you can go to the hospital and you can get taken care of, and you're not going to be in debt for the rest of your life. You're not going to have catastrophic economic outcomes because of that. So I think UHC would be the biggest thing that I would take home. But also, again, I think that our societies were too overcharged to begin with. And I think that hopefully this pandemic helps us shift to more flexible working. I think people are probably more productive working at home anyway. At least my husband looks like he is. So I think that we should allow flexibility, and also, that flexibility can help us to take care of our families and show up for them better as well. So yeah, I think that's what I would say.
Amazing. Well, I'm going to bring this to a close now. Thank you so much, Ngozi Erondu, for joining us today. It was really, really fascinating to hear all of those questions answered. I hope everyone that joined us found it as useful as I did. I feel a lot more informed now. I can go and argue with my brother from a position of strength about what we should be doing. Yeah, so thank you everybody for joining us. If you want to find some more content on coronavirus, more explainers, more analysis, there is a lot of content on the Chatham House website that can help you navigate your way through this. And yeah, have a lovely evening, everybody.
Thank you so much. And those are really great questions, everyone. I really appreciate it. All right. Take care.